Hi everyone, welcome to the stream today. Thank you so much for joining me. I am Dr. Sylvia. I'm a general practitioner. I'm also the founder of AskAwayHealth, and I'm so thrilled that you've taken some time out of your busy Friday to spend an hour or so to me while we tackle today's stream topic, which is answering questions about commonly asked questions about oral contraceptive pills 2022. So how are you doing? How is everyone? How are you keeping? Whether you're watching me on the live or watching the replay, I hope you're well. And I hope that you have a nice weekend planned ahead. So guys, we're going to jump straight into the questions. I have about 9 or 10 questions. We're going to go to them straight away. But if you have any questions around oral birth control, any queries around side effects, what to expect on the pill, issues that have come up with using the pill, send them to me in the comments. Let's have a chat about them. Let's see if we can help you tackle, clarify, and so on. You know, all that stuff. But before I go into the questions, I would love to promote my partners, StreamYard. You guys know I've been doing live streams for over a year now, and mostly have been using StreamYard. I think they are amongst the best in the game for this kind of activity. StreamYard is so easy to use, and all you need to do is create your account. All you need to do is, when you're ready to stream, log on to the portal, and it's very straightforward. If I can do it, so can you. You've got the free option, and of course you've got more perks with the paid option. But even using the free version, you can, as a creator or somebody who's a health educator like me, you're able to reach such a wide audience with an amazing platform. So if you haven't used StreamYard, or you're thinking about live streams and wondering how best to push out your message, consider StreamYard. I'm going to have a link in the description to their tools, to their site, so you can get started if you're interested in live streaming. So if you're joining the stream, hello, welcome. How are you? Where are you? Tell me what you're doing this weekend. Tell me where you are, what the weather is like where you are. Let me go straight to the first question. I'm just going to put it up on the screen so that you can have a look at it while I read it out to you. So these questions, not that one, come on. So these questions have come from while we're doing that, while I get the first question ready, these questions have come from, you can see how technical I am, can't you? Just trying to get a question up on screen. So these questions have come in from viewers on my channel, or through our Facebook or Instagram or Twitter platforms, or directly on the website. And if you don't know, my website is called AskAwayHealth.org. It's an amazing platform where you can learn lots of things about your health, whether it's women's health, sexual health, whether it's your general health or something to do with your children. You can learn. You have the chance to send questions in. You have the chance to use our forum, where you can chat with other people with similar mindsets and get ideas and get opinions about things. So please use any of our media if you wanted to send a question, or just wanted to communicate or contact us. Of course, you can use the email health information service. Now that's dedicated to people who want a specific response to a health inquiry, and I or one of my colleagues will send the response to you by email. All the links will be in the description box below. So if you're interested, please go and have a look. I will be adding all these by the end of the stream. So question number 1. If after unprotected sex on day 1, and I took a pill and had another unprotected sex on day 3, do I still need another pill, or is the one from day 1 still effective? Very good question. Very common. See, the answer to that is no. We're going to be as brief, and you're not going to spend too much time. You're not going to put any fluff around these things. The answer to that is no. When you take and so this is referring to the emergency birth control pill now, not the regular pills. So when you take the emergency pill, what it usually does is, one of the primary way it works is to delay ovulation, usually for a period of 5 days. Within those 5 days, the sperm that your partner released from that time of sexual intercourse should have died off. Okay, and then ovulation happens, and then pregnancy is avoided because the sperm have gone. If you have sex again on day 3, you cannot rely on the pill you took 2 days ago, because by having sex on day 3, your partner releases a fresh amount of sperm who are going to survive for another 5 days. Don't forget that your pill taken on day 1 only covers to allow the sperm from day 1 to have died. If you have sex on day 3, the sperm are going to live a couple of days beyond the allowance for which the pill you took on the first day covers. So the answer to this question is no, and it's simply because by having sex on day 3, a new load of sperm which will survive 5 days, 2 more days longer than what the first pill you took can cover you for. It's as simple as that. And this is why we recommend that you are on a regular birth control method, okay, and do not rely on the emergency contraceptive pill. It's called emergency for a reason. That reason is that it's only for when, I don't know, something just happens and your regular method is failed, or you've not got access to it, or whatever. It should be only occasional use, sparing use only. So that's question number 1. Let's go quickly to question number 2. Don't forget, you can send questions in to me as well. Please feel free, if you want me to tackle a question or to look at a question that you want us to consider. That is not a problem. I'm just going to put up number 2 on the screen, and then we can go through it together. Here we go. Oh, guys, don't forget to like and subscribe. Please don't forget to like the video and share it. If you find this information useful, please share it with a friend or family so that we are learning. We're getting more and more informed. So next question. My friend took the pill 4 days before her period, and now she's 6 days late. Should she be worried? So, we have to put this thing in context. Should she be worried? She should be concerned. She should be thinking about what's going on. Should she be panicking and anxious? No. Remember, and I've got lots of videos on the channel that you can go and have a look at after this. The Smart Emergency Birth Control playlist, highly recommend. I will put the link in the description box for you below. Remember that when you take the pill, and again, this is the emergency contraceptive pill question again. So it's for emergency use only, and it has a number of effects on your period, possible effects on your period. It may do absolutely nothing. It might bring it forward. It might delay it. Those are the possible options that you could have as an effect on your period after taking the emergency pill. So if you say you've taken the pill and your period is a little bit late, that's not unusual, especially if it's still within the period of 5 to 7 days. So if you haven't seen your period for 5 to 7 days, you can think, right, this is probably the pill's effect. But we always recommend, once the period is more than 7 days late, go and do a pregnancy test, because there's no point thinking or wondering, there are no signs that can tell you the pill has worked, or there's nothing. It's a pregnancy test. So to answer this question, I would say she should be conscious that, when should I expect my period? She should be alert. That's what she should be. There's nothing to panic about at this stage, if at all. She should be thinking, right, when do I expect my period? I've had the pill, it could do something to my period. If it is within 7 days, then keep an eye out. By day 7 and you still haven't got a period, go and get a test. Go and get a pregnancy test, okay? And sometimes what the way the pill works, it could differ from the time that you take it during your cycle. Let's not get too technical. In some cases, it might bring the period earlier. In some cases, it might bring it later. Depending on when before and after ovulation you take it. The key message here is, sometimes after taking the emergency birth control pill, your period can be delayed. If it is within 7 days, then you can still wait and watch. It might be a pill side effect. If it is more than 7 days, go and do a pregnancy test. Usually we do advise women that if you've had the pill at some point, the emergency pill at some point in your cycle, go and do a pregnancy test when it's 2 or 3 weeks after you had that pill to check, okay, so that you're on top of things and there is no need to panic. So that's our second question. For joining the stream, hello, say hi, let me know where you're watching from. Thank you for joining. And we are talking about commonly asked questions around the oral contraceptive pill. We've gone through the first couple of questions, and let us now tackle number 3. I'm just going to put that up so that you can see it along with me. So let me just add that on here. I think there are quite a good lot of questions. To be honest with you, there are so many. I don't think you can actually You can actually, gosh, there's so many different questions that people have. But I just thought if we spend about 45 minutes going through them, it's really educated. I think. So this next question, I couldn't get everything into the text box, but this next question says, I had intercourse on the 12th. And then they say my fertility window is from 12th to 17th. Okay, so they've probably got an app or they're tracking fertility, their fertility window and their ovulation is very good. Every woman should be comfortable with doing this, should know whether you're using an app or the calendar, whichever. So she had intercourse on the 12th. Her fertility window is from the 12th to 17th. So what she's saying is she had intercourse at the time when she's most likely to get pregnant, which is what your fertility window is. Then she took the pill on the 14th. So she took the emergency birth control pill 2 days after. My question is, does the pill work during your fertility window, not ovulation day? I know it didn't work on ovulation day. Well, the pill can still work on ovulation day, okay? The principal way the pill works is by delaying ovulation, but to a lesser extent, it can work by preventing fertilization. So it can make affect the way the sperm travels, slow the sperm down by making the mucus, the woman's cervical mucus, a bit thicker, so the sperm don't swim as fast as they can to fertilize the egg. That's another method that they could work. They could also affect the lining of the womb, making an implantation. That is, if the egg manages to fertilize with the sperm, then makes implantation impossible or prevents implantation. So those are some methods that the pill could work. That's the emergency pill. I need to emphasize it, please. That's the emergency pill. But delaying ovulation is the principal method. Now, going to this question, does the pill work during the fertility window? Yes, it can. Yes, it can. So if you've taken the pill a couple of days before the day you ovulate and you're within your fertile window, yes, the pill, that's what the pill should do. It should delay that ovulation. I would probably be, if I were going to be very strict, I would say, take the pill as soon as possible. She left it 2 days, I think. Yeah, she said she took it on day 14, the 14th. So 2 days after she'd had intercourse. It's still going to work, but of course, it is not as effective as if you're taking it on the first day as soon as possible after intercourse. But it will still work. So the bottom line is the pill is not 100% guaranteed to work. But I would say that in the event that one finds oneself in this kind of circumstance and you're not, you're trying to prevent an unplanned pregnancy, then of course you should do what you can, everything that you can, which I think is what this lady is doing. So I wouldn't be panicking. I think she's taking the pill within 72 hours. That's fine. She's taking the pill within her fertile window, but a couple of days before ovulation, that's fine. And even if she's taking it on ovulation day, while we say, okay, perhaps she's past the window when the pill can still delay ovulation, other methods, for example, making the cervical mucus thicker or preventing implantation, may still turn out okay for her. This is why we say it's not 100% effective. Do a pregnancy test 2 to 3 weeks after. But yeah, that would be the best way to answer that question. Okay, my friends, we are going on to our next question, and let me pull it up and share it with you on the screen. So let's take this one away. I hope you guys are doing well. I hope you're finding this useful. Always happy to get questions from people. Please don't forget to like this video, and of course, do kindly subscribe to our channel. So here we go. This question says, I finished my last pack of pills. Oh, this is an interesting one. Okay. I finished my last pack of pills. I had my period after the pill. And after 1 week of my period, I had spotting. The spotting is now on the 4th day. I also have cramps. Is that normal? So this is an interesting one. First of all, because look, I would love to have a lot more information. This is why when I get these kind of questions on YouTube and why I created the information question, and you need a lot more to clarify. So it's not because we don't want to answer the questions, it's because we can't really do much with this information. You need to ask a lot more. But let's go with assumptions. Okay, and the assumptions here are perhaps she's on 1 pill pack a month, because don't forget, some women might be on a continuous or extended regimes. These are the sort of new tailored regimes that you can have, where instead of having, for example, with the combined pill, instead of having a 21-day pill and then 7-day break when you're not taking the hormone, you can actually have 63 days of your pill and then have your pill-free break 7 days. So there's such regimes. I don't know what she's on. It's I can't tell, but there's so many different regimes. And just as an aside, one of the benefits of these new tailored regime, particularly for those of us girls that have problems like troublesome headaches when we come off our pill during that 7-day break, or have troublesome side effects spotting in between, or when you forget, because you've gone out of your rhythm, you forget to take your pill for a couple of days, and then you extend that period when you could get pregnant. So there's some advantages to these tailored regimes. That's not the purpose of today's discussion, so let's not go into much detail. I'm just trying to establish that I don't know what when she says I finished my last pack of pills. Anyway, let's go on. She says, I had my period after the pill, which, as you expect in your period, your pill-free period, or your pill-free time. So she had her period, and then she had the period, and after 1 week she started spotting. So we call this breakthrough bleeding, don't we? So she's having unexpected, unscheduled bleeding, and it's 4 days now. It's just spotting, but it's 4 days now. She's also getting cramps. Is this normal? Okay, now you can see I can't say yes and I can't say no. Because there's so many reasons that you could have unscheduled bleeding while taking the pill. Many reasons. Please don't there's nothing, is it normal or not? There isn't really anything like that. Okay, when I know what she means by is it normal, I know she means is this an effect of the pill, but I can't tell you that, because many other things could cause you to have this abnormal bleeding. For example, pregnancy, for example, a sexually transmitted infection. Without checking these two key things, there's no way we can say this is normal. We don't know. We need to look into the issues, and especially when you're getting cramps. Now, don't get me wrong, you can get cramps, starting with the pill. But how do you know? Or let's be, you guys listening, you guys watching, let's all be the doctor, and this is our patient. So let's think about this. How do we know whether she took in her last pill pack, she took it all the right way? Maybe she missed a couple of pills during the month. Okay, and when she did that, she exposed herself, and if she had intercourse, then she might be pregnant. How do we know? How do we know this is not implantation bleeding? We don't know. How do we know this is not an ectopic pregnancy? We don't know. So yeah, this is why we can't say it's normal or not, because you need more information. You need to clarify a few things. So I don't know if she's if you're watching, if you sent this question and you're watching, I think I responded to it as well, but please bear it in mind that there isn't a simple, straightforward answer. There are a few questions that need to be asked before you assume that this spotting is simply an effect of the pill. And then, so to come to that level, yes, it is possible that for some reason, if you're just starting the pill, this is the first few packs that you're getting, if your body's just getting used to it, you might experience spotting. But I'm just a bit suspicious and just a bit, with the cramps going on as well. I would love to clarify first. So I'm not going to give you a blanket yes or no answer. We need more information is the way I would look at that. So that's that question. Oh gosh, I'm sorry if I sounded harsh, but this is the truth. Okay, this is the truth. Let's tell ourselves the truth. Okay, let's go on to the next question. Let me edit that and put it up on the screen for you to see. So while you're looking at, you can't see because I haven't shared it yet. There we go. I love a stream that makes this thing so easy. Okay, so that's the next question. Let me get a drink. Okay, so I know this is an implant question. And we're talking about the pill, but I just put it up because some of the reason or some of the solutions to this challenge would involve the pill, and I'm not sort of going to give you what the specific solutions are, but just so that you are aware in case you're in this kind of situation that you're taking the implant and having troublesome bleeding. So this is somebody who's been on the implant and she's been bleeding for over a year and is not sure what to do. This is not an unusual scenario, to be honest with you. But again, if you come to your doctor with this story, we we would be very keen to make sure that there is nothing else responsible for the bleeding. Really important that we don't assume because a lady is on a contraceptive or birth control method, any funny kind of bleeding she has or any unscheduled bleeding is because of that method. It's our responsibility to, look and check that it's not pregnancy, it's not an infection, it's not other things like a polyp or cancer and so on and so on. But once that's done and we're satisfied that there's nothing else going on, it's the implant that's causing the problem, what do we do? So of course some ladies will be like, you know what, just take it out, I've had enough. And we don't know how much bleeding she's had, we don't know. Remember that bleeding is for women, different women, it's different. Some it might be spotting and she doesn't mind. Some it might be heavier, some it might be spotting and she does mind because it's just a nuisance, for goodness sake. It's ridiculous. So depending on what the lady is saying, she might want to have it off, okay? But in this instance, she doesn't want to take it off, and I thought that was really interesting. She said she doesn't want to take it out because it makes her feel safe. Okay, so there we are. We've all got different, what's important to us is all different. And for her, it's important that she feels safe. I think, if I remember correctly, perhaps she might have used the pill or other methods and got caught on them. And this is the method, or she might just be rubbish at taking the pill. Like some of us are, remembering, you have to take the pill at the same time, every day. So you are supposed to, there must be something that reminds you. Some ladies will take it first thing as they wake up, some will set their phone alarm or whatever. Everyone's got their system, but some people just can't. That just is just not for them. And that's why things like the implants, options like the implants are really useful for people who it's there for 3 years. I don't have to think about this anymore. I'm protected. So here she is. She doesn't want to remove it, and so we're working with what she prefers. She's just looking for ways to reduce the bleeding. So the simple answer I wanted to give to that is that there are ways that you can reduce the bleeding. There's some that you can use hormones to reduce the bleeding. That might be taking a combined pill method in addition for a short period of time to slow down and regulate that bleeding. So that's one option that might be considered. Of course, it depends on your history. Not every woman can safely have the combined pill. Remember, it's got estrogen and progesterone. And so if you're going to take that, it must be that you're eligible, medically eligible. So you're not excessively, your weight isn't excessive, your blood pressure isn't very high, you don't smoke, you're not over a particular age, and having those or a mixture of those sort of risk factors might make the combined pill, dangerous for you. So if that were the case, that wouldn't be a suitable option for this particular person with this question. And of course, another method there are a couple of other methods that your doctor might consider, nothing to do with hormones. There's some evidence that they might make a difference. So there are solutions for a circumstance like this. And that's why I thought this question was interesting to mention, because there are some methods like the implant or the coil where bleeding just carries on a bit longer than what we'd expected, because you love that method, you don't want to stop it, you just want to see how you can control the bleeding. And if this lady were going to use the pill on top of the implant, it's for a short period of time, so maybe for about 6 weeks tops. If it seems to be working, she might continue for another 8 or 12 weeks and then stop. So it's not meant to be continued. It's just that it might be she's one of those people who takes a little bit longer for her hormones and her body's activity to return to a normal level after the implant starts. We're all different, but it's worthwhile just being aware that this is a possibility. So you don't have to lose a method that you like. There may be something that could be done with that method. So let's pause. I think that was what I wanted to cover with that question. So let's go on to the next one, and I'm going to share that with you. I couldn't get all the text in. This is from a boyfriend. I get lots of questions from boyfriends. And that's fine. That's fine, because what are we talking about? They should be totally part of this, business. Shouldn't just leave the girl wondering about what to do with her emergency contraception. So this question says, my girlfriend took Plan B around 10 a.m. and around 3 p.m. she developed a stomach ache and felt as if she wanted to vomit. She felt as if she wanted to throw up. Around 5 p.m. she took some milk. Can the pill still work, or should I buy another pill? Okay, so this is an interesting question. Hi there, if you're joining on the stream, thank you for popping in. Let me know where you're watching from. I just appreciate your being here today. Thank you for joining. If you've got a question around birth control pill, we're talking birth control pills today. So shoot me a question if you've got one. So back to this question. So okay, so I think the key thing here is things that could prevent Plan B from working. I think those are the key questions here. And one of them is if you vomit or if you have diarrhea. And I think that's what he's concerned about here, because he's heard from somewhere that sickness or something might affect the pill. Now, I can't see anything here that would affect the pill from working. If she vomited, that's different. And in fact, if we want to be very strict about it, what we say is if you throw up within 2 to 3 hours of taking the tablet, then you can assume that you've not digested it, and so it's not worked. But if you took the pill at 10 and you threw up at 9 p.m. or took it at 10 and threw up at 5, your body would have processed, that would have gone through your system, into your intestine, absorbed into your bloodstream. So those are the things that are important. In this case, I don't think he needs to buy another pill. He says she got a tummy ache. Now, that tummy ache might be completely unrelated to the pill, but if you look at the leaflet of your emergency pill, you would see that it can cause a little bit of an upset tummy. It does have side effects, so not horrendous ones, so fairly niggly things like feeling a bit nauseous or a belly ache, vomiting even as a side effect of the tablet. So it may be that she developed that tummy ache because of the pill, but even at 3 p.m. when she developed the tummy ache, it had already, I would say, had been absorbed, because that was a good 5 hours after she'd taken the tablet. She felt sick, but she didn't. She took some milk. The pill can still work. The pill still worked. So I haven't seen anything, unless there's anything else. He was saying, should he buy another pill? I don't think he needs to buy another pill. I think it would still work. So that's the answer to that question. Okay, so let's move steadily on, my friends, and let's have a look at the next one. I'll just put that on the screen. Ooh, no, not right. Let me just okay, so I'll just share it. Okay. Yeah, okay. I wish to know which pill I can use to avoid getting pregnant, because I wish to visit my boyfriend for a week and he does not want to use a condom. When I saw this, I just, so yeah, I think it's something that you should be thinking about. If you're at this stage where you choose to go into sexual relations and you're not prepared to get pregnant, then it's reasonable to think about what method. Now, if this is a visit that's coming up in the next month, okay, so we've got 4 weeks before this, and you're thinking, okay, I need a method, then I'd be recommending a regular method. I'd be recommending a regular method like the pills. It all depends on the person. You could use the implant, you could use the coil. So all this, of course, depends on being able to get into your health provider and get all this established. And it is not impossible if it's just 4 weeks or 2 weeks. Depends on where you are. Depends on the service that's available to you. If this is we're asking ourselves this question on a Wednesday, and this planned visit is tomorrow or Saturday, then there isn't, okay, so what I want to be very clear is that there isn't a pill that you can just take now and, you start, if you have sex the next day, you're not going to fall pregnant. So there isn't that pill, okay? And regular pills, you can start taking them at any time, of course. But if you take them outside of your period, you're going to need to use extra protection for 7 days, e.g. condom. And she's already said he doesn't want to use a condom. I wonder what her view on this is, because, he can't just say he doesn't want to use a condom. He can't just say he doesn't want to use a condom, because this is something that affects you both. For the lady, you're the one, if you get pregnant, you're the one going to be dealing with the, all the fallouts, at least for the next 9 months. So if the condom is all, if the condom is all that you can use, because you don't have anything else, then you need to insist that we need to use the condom, because it's protecting you and protecting your partner as well. So I'm not sort of quibbling with that, he does not want to use a condom. I think that you have equal agency as he does in your relationship, and you should be saying, dude, we haven't got this, we haven't got that, we need to use this condom. And this is in the instance when you're not able to get the regular method set up. If you could get the regular method, let's say you could go to your doctor and you have that chat. Remember, when you come to a consultation to start the contraceptive method, there's a lot of information we want to get, because we're trying to establish that you are medically eligible. So we're going to go through your medical history, make sure that you're suitable, look at any possible medical problems in your life, in your families, that might suggest an increased risk of side effects to the pill. And apart from that, we'll need to check your blood pressure, need to establish your weight, if you're smoking. Now, of course, there are different types of pills. So there's the combined estrogen and progesterone pill, and there's also the progesterone only, which can be used for women in whom estrogen is not safe. So there are options, okay? There are options that if she went to see the doctor today, okay, and she's suitable, she can walk away with her pill packet, start it straight away. But again, if she's not within her period, she's looking at extra protection with the condom. So I just thought this was an interesting question, and I haven't mentioned emergency birth control, because remember, that is for you to use after the fact, after you've had intercourse, and it's not supposed to be used every single day. So that's, for me, really, for this kind of question, is not an option. This is, when you, as a young woman, as a person, as a lady, if you go into this situation and you're thinking, how do I protect myself? This is something you need to sit down and really think properly about. This is something that you need to take some time. It shouldn't be something that it's a knee-jerk response, because knee-jerk is more likely to get you into trouble. If you haven't got something that is, you've thought about it, the method that works best for you, you've sat down with your doctor and gone through the key things, knee-jerk is something that could get into trouble. So there isn't a which pill I can use. There are lots of different pills. There are lots of them. I get the sense that this person just wanted to know the name of a tablet like acetaminophen or paracetamol that she could just take, and hey, bingo, job's done. That's not the way it works. Because these medicines, these pills, can have significant effect in the body. Some women have horrendous side effects. There's some complications that might develop if they're not right for you. So this is someone that should be having a chat with her doctor. This is somebody I'll be saying, book an appointment, let's have a chat, and let's talk about what your needs are and what is best for you. These are the options, and then you can choose. And then we'll tell you, okay, this is how you're going to start taking it, this is when to start taking it, and you've got your protection, and so on and so forth. So that's how I'm going to answer that question, referring this person back to their clinician to have a good discussion about what options are available to them, how to start taking them, make sure that they're properly checked, their blood pressure, weight, and all the bits and pieces that your doctor needs to do is covered. So that's the answer to that question. Okay, so we're moving on. I'm glad we're covering, I think we're keeping good time. Yep, just nearly over the half hour mark. That's fantastic. So again, please don't forget to like the video. I'd really appreciate it if you share it as well. Don't forget to subscribe to the channel. That really makes us so happy, guys. We're growing, and I was thinking the other day, we're just over 2,000 sometime last year, and it's just the pace of the growth, the fact that we are increasing and doing in little ways, making impacts. I think that's so constructive and positive. Okay, so I'm on the combined pills. Should I stop taking birth control if I get COVID? So yeah, this is a nice question, of course, on the back of current goings on. COVID hasn't gone away. There is no evidence at all that we have to say you should stop your birth control at this point because of the COVID-19 pandemic. However, if you're diagnosed with with COVID-19 and you're using the birth control pill, there is some there's some suggestion and there is guidance. I would recommend that if you have the infection, I would say stop taking your pill. That would be my recommendation. And let me explain why. We know that one of the complications or side effects of using, especially the combined pill that contains estrogen and progesterone, is the possibility of developing blood clots. So blood clots are when the blood thickens and becomes solid mass within the blood vessel. And that can happen in many different conditions, don't get me wrong. It can happen, it's actually of a greater risk if a woman is pregnant. Blood clots can develop. People, for example, who've just had surgery and they're having to remain in bed for several weeks because of their surgery, or people who've had an injury and they're in bed. Older people who are not very mobile and have to remain in bed, those are the kind of people that are at an increased risk of developing blood clots. There's some other categories, but just to give you an idea, using the combined contraceptive method, the pill, for example, also can increase a woman's risk of developing a blood clot. But we've also found that with COVID-19, lots of studies indicate to us that there is also a risk of developing blood clots. So you see why I say that if somebody does have the infection, it's reasonable to come off the pill method. I mean, to be fair, I always ask myself this, if somebody is so ill, of course they're not thinking of having sexual intercourse, but that's not just the reason. You're supposed to continue taking the pill on a regular basis. Normally, whether you have sex on that day you're taking the pill or not. So if somebody does have the COVID-19 infection, I think it is reasonable to say stop taking the pill for this period of time until this infection has completely cleared, you've recovered fully, then you can resume your the method. However, there isn't any guidance to say to us that because we're recovering from the pandemic or the threat of the pandemic means that if you're taking the combined pill that you should stop it. Nothing like that. Simply for somebody who has symptoms, who is diagnosed with the infection, and we are just saying that because both of them can increase the risk of having blood clots, it makes sense that you come off the pill until you've completely recovered, and you can then look at either continuing or an alternative method. So that's why this question is important. I think it's a reasonable question to ask, to think about. Ask your doctor if you get COVID infection and you happen to be on the pill. To be fair, I've not really had much reports of somebody developing blood clots because they got COVID and they were on the pill. But again, I think it's something that is reasonable. It's a reasonable caution to have, and it's worthwhile considering and discussing with your doctor as well, just given the fact that the pill does have that risk of causing blood clots. So now let's go. We are on the last question, so I'm so glad that we've been able to get through. I wasn't sure that we'd be able to get through all the questions that I got in, so I'm glad I've been able to get through. And we're on the last question. So I'm just going to read that out. And unfortunately, I couldn't get the whole question in, but let me just read it out. So it says, I bled after taking Plan B on the day that was supposed to be my ovulation day, 4 days after taking the pill. And it's 1 month and 2 weeks now, yet no more periods. I've done a pregnancy test, negative. Then I went for an ultrasound, still nothing. I'm worried, but I think I should give it 1 to 2 weeks, then go for a blood pregnancy test. Oh, so yeah, that's the bit that's missing there. Yeah, so she said, I've done a pregnancy test, it's negative. She's done a scan as well, and that was negative. So she's worried. And she says, well, I think rather than panicking, I think I'll give it another week and then I'll go for a blood pregnancy test. And she wants to know what we think. So yeah, so this is an interesting one, isn't it? So after taking Plan B, she bled on the day that was supposed to be her ovulation day. So let's do some calculation. Let's put on our calculator hats. So 4 days after taking the pill, she bled, and that day I bled after taking Plan B on the day that was supposed to be my ovulation day. So the day that was her ovulation day was 4 days. So she was in her fertile window basically when she took the pill. Okay, well, we know the pill. We've answered a question earlier, didn't we, where we said that the pill can still work in your fertile window. So yeah, that's fine. So she bled after taking Plan B, and the day that she bled was supposed to be her ovulation day. So she took the pill before ovulation, good. She took and then she had bleeding on the day she bled 4 days later. Okay, so that bleeding obviously could be just unrelated bleeding, because remember one of the things that the pill can do is bring your period forward by a few days or delay your period, do nothing about your period, and then you could also have unrelated bleeding, so just bleeding because of the hormones in the pill. And it's probably this fourth one I think that's happened. So she's had that bleed and nothing since then. Is 6 weeks now. If she were pregnant, a scan would have picked up, because she said it doesn't show on this because the space for the text is cut off, but she says she's done a scan. And if she were pregnant, she's 6 weeks down from this whole event, which is around the time when she had intercourse. We should see something on the scan. I don't think she's pregnant. I think that this is an effect of the pill. What is interesting here, and if I had her in front of me or we're doing a video chat, I'd be saying, so let's sort of look at what's happened in the few weeks before. Were you on any form of any other hormones? Are you on any other medication? What's been going on in your life? Any kind of stresses and so on, just to try and work out, if anything. There might be nothing. It may simply be the pill, but you can see how distressing this could be. So what we can establish here is that even after taking the pill 4 days to the day of your ovulation, that is within your fertile window, the pill can still work, because like I said, she's done an ultrasound scan and it didn't show any sign of pregnancy. So I think that she's not pregnant. I think that the pill did what it was supposed to do. We all vary, we're all different in the way that the pill can affect our cycles. We're all different. I think that she should be seeing her doctor to sort of look at, could anything else be responsible for the delay in the period? If there isn't, then it's likely the pill, and her period will soon show up. When? I don't know. We don't know. It's one of the things that we're still looking at in terms of nobody can predict to you when you take the pill and your period is delayed what might happen. The studies generally indicate to us that the period should come back most often within 10 days. But we know some women where it could happen in the period could be delayed for up to 20 days. Okay, what you commonly find if there's a delay is by 7 days back, 10 days. Sometimes I think it's about 10% in the studies that we did. I went through. More than 20 days is not impossible, but we're talking a month and 2 weeks, so that's quite long now. And when she does her pregnancy test, which is fine, I think it's going to come back negative, but when she does her pregnancy test and it's negative, she should be sitting down with the doctor just so that we can have a look and make sure there's nothing else that could be affecting the period and causing it to be delayed. And if you know what those could be, I recently did a video, I'm not going to spend much time talking about this. I recently did a video where I talked about things that could affect your period and cause a delay in the period, so please go and have a look. Okay guys, wow, thank you so much for everyone who sent in their questions. Really glad to go through them on this stream, and I hope that you enjoy watching this, especially on the replay. Let me know. You leave a comment for me, leave more questions. Some of them we can address, some of them I will direct you to the email information service if we need some more information. But don't forget, please use the community forum. Okay, use the community forum to start a discussion or to answer. It's good to share experience. We learn from that. So I hope that you come and join us in the forum very, very soon. And thank you so much for spending this time with me. I hope you guys have a lovely weekend, and have a look, or one of the videos we shared recently, I think, is on bleeding after sexual intercourse after the menopause. Yeah, that is a thing. So this, of course, will apply to a slightly different group of women. But if you know somebody who might be interested in that, please share that video with them. They might find it useful. All right, guys, thank you so much for watching. Take care. Have a great weekend. Bye.